Infertility, causes, symptoms, and treatment options. Infertility is the inability experienced by an individual to reproduce naturally. The term is generally used in the case of human beings, but it can occur in animals and plants as well. Although this is not particularly a disease, it can be regarded as the inefficient functioning of the reproductive system. In the case of humans, it is the incapability of getting pregnant, even after prolonged unprotected sexual intercourse for more than a year. Lately, infertility has become quite common among couples residing in the urban areas in the backdrop of their hectic and fast-paced lifestyle. Improper eating and living habits are taking a catastrophic toll on the lives of people, resulting in stress, anxiety, depression, and many more related problems. All of these are highly contributing to the fall in rates of conceiving. Causes of infertility. In the case of men, the prime cause can be a low sperm count. Generally, a man ejaculates around 20 million sperms. However, anything lower than a 15 million count is considered as low. Alongside, if the sperm is less mobile in nature and, as a result, is unable to swim towards the egg, then infertility occurs. For women, the normal age for conceiving generally starts to deteriorate after 30. Excessive smoking and alcohol intake are also probable reasons for infertility. Being overweight and a lack of proper diet are also some of the factors that can cause infertility. Symptoms of infertility. Pregnancy in women is directly related to menstruation and ovulation. Therefore, changes in them can easily indicate infertility. Some of the symptoms of infertility have been listed below. An irregular menstrual cycle is one of the first and most important signs that show up in women. Bleeding may either be heavier or lighter. Even the days between each ovulation cycle may vary every month. Sometimes, there might be no period at all. This sign is often confused with conceiving, but one should be careful in assessing other signs as well. Sometimes, when the bleeding occurs, it is associated with pains in the pelvic region and in the back. Cramps are also commonly known to occur in such cases. In men, the symptoms include changes in hair growth. This symptom is also common among women. Often smaller and firm testicles in men can lead to a lower fertility level. Even pain or swelling up of the testicles are probable signs of causing infertility. As mentioned before, a change in lifestyle has become prominent as individuals, both men and women, have introduced many changes in their lives. When this prevails for a longer time, it will lead to infertility. Other problems in erection and ejaculation are also potential drivers of infertility. Treatment for infertility. It is very important to identify the cause of infertility at first in order to get proper treatment. The treatments that can be availed by both men and women as per their needs are mentioned below. For women, infertility can be treated by injecting hormones or fertility drugs. This will help the woman in ovulating or even restoring the level of hormones. In case there is any tissue that is blocking fertility, such as any lump in the fallopian tube or nearby regions, then surgery is the best option. This will help in removing the lump and also restore the normal functioning of the reproductive organs. For men, for deficiency of hormones, hormones are injected to increase the levels. Antibiotics are also provided sometimes to treat infections in the reproductive organs, if any. In the case of a blockage in the vas deferens, a surgery might be performed to remove the tissue causing the blockage. Medicines and counseling may also help at times for problems related to erection and ejaculation.